Sioux Lookout First Nations Health Authority, or SLFNHA, presents SLFNHA Radio Connect, building strong connections with communities by sharing who we are, how we can help, and the services we offer. Ako Wiindamekewinan, Sioux Lookout First Nations Health Authority gajgadig, egochke eskam SLFNHA visionkate. Miwa kegunenan iwanun keguns wichi guyagban ima iskunaganang kazgabeshig, egochke iwanun SLFNHA Wiindamekewinan. Greetings. My name is Charles Mikas, and I will be your host today. I currently work in the Wiindamekewinan department at Sioux Lookout First Nation Health Authority. And I'm originally from Sandy Lake First Nation. I've been with the organization now for about 8 years. Bozo waje gidna egama ngagakugajma we oguma kegunenan iwenun akuzib mujgaunan Wiindamekewinan Sioux Lookout First Nations Health Authority. Welcome to today's program. We're excited to have Karen Mikas and Candy Edwards from SLFNHA. They are here to speak about the programming and services that approaches to community well-being and how SLFNHA is continuously looking to promote health and prevent illness. Bojo gidnguna migo etska bizindamek nomagizgak. Ego awenug Karen Mikas, ego Candy Edwards izin kazwag awenug kanigan skamwajiwe approaches to community well-being gajgadeg ahingi ma Sioux Lookout First Nation Health Authority. Ewista dazindama jiwenun anin meaminan kua jiwen ka wichtoaj ega osmeo ya jahuzj.
Miigwech for having us. We're excited to be sharing with you today.
Miigwech ka ayaw shank. Nchiken damen chibuichiu goyen.
Before we start, please tell us about yourself and your history with SLFNHA. Ega manuguk kakanagagunan geda dazin damak gadawin damosnam na bangi awanen ginegwa and wenjin.
Hello, everyone. My name is Karen Mikas. I came to Canada when I was 19 years old, and my first job was a school teacher in a remote First Nation community. I quickly fell in love with the North, the people, the land, and the strong sense of community. I knew right away that this was where I wanted to stay. I later married a member of Deer Lake First Nation, and together we raised our family here. I'm from the Kiiwetinoong Nation of Oklahoma, and I've been proud to call the North my home for over 30 years. I'm now a nurse and have worked in northern communities for many years. About 4.5 years ago, I joined SLFNHA as the Community Wellbeing Nurse Manager. I was hired to help build our first public health nursing program. It was my first time working in public health, and I learned so much about what public health means to SLFNHA and the communities we serve. Public health is very important because it focuses on keeping people healthy before they get sick. When we spend more time on health promotion and prevention, we can reduce serious and emergency health problems later on. I believe this is one way we can help make healthcare in the North stronger and fairer for everyone. And over the years, I've continued my education in public health because I truly believe in its power to make a difference. I'm grateful to be serving at SLFNHA as the Acting Associate Director of ACW.
Wajia gakanawia Karen Mikas ndisnakas. Magag pisayan Canada megwatingi sangsuza bebone. Ego das nistam magagi matan kian gi skoni hiwe an sinikang. Apet das wiebad mawatingi saktun et Kiiwetinoong an sinog akke mina maskawat suat awiak. Gikendan da shemak mi humaga wis gabeshan. Nage dasingi awa basic na bewe the Deer Lake First Nation. Ego dasingi en machi unijan simen. Ego with the Gaunjian Kiiwetinoong Nation with the Oklahoma. Ego das mawats en tendan with the Kiiwetinoong. Iwe nga peshoen chitaman aja wasmen sumitanaw yakke. Ego das nongum asana maskikko, ego das machiniakasu et Kiiwetinoong na bianki, nanda Wiindamekewinan nigipe matankawa SLFNHA. My community well-being manager eginiganskaman hiwe skunagan minyawan. Ego das ngiu dapen go hiwe janu natuan stem public health nursing program hiwe gaknawi again to minya to which goen. Mi wenin bias hiwe en kadaman gaknawi o munyawan. Ego sapet mistahin gipekendan kegunen gaknawi o munyawan guys nikadang SLFNHA. Ego skewet abona kagan kawangito. Kaknawia omanyawan mawat kachinen dagwan. Imayas kanwapan sagade kakna awia. Chiminya yach. Igapan maakosit kagwewichinch. Ego tasihuwe gan kadamak. Chuan sit tangawia keito tang chiminya chiminega chahkosit. Ego hima pits tawan chitakwawan, hiwenon kchakosuna nagenowach. Michues debehtaman, mihuwe pesgoyek wet minyawan kekipito Kiiwetinoong. Hima chunche maskawatega naponan, ego minachiminyawach awiyak. Ego tasweda ka papimiyakiwaken, mihuwe gabajeshe bimek kentaman kaknawia omanyawan public health. Hiwe tas tebwehtaman apiche maskawasima kakiwe wichiwewan. Mawat tas namanindan humwa SLFNHA ka anukawak.
Bonjour, I'm Candy Edwards, Wiindamekewinan. I've been the Director of Approaches to Community Wellbeing at Sioux First Nations Health Authority since September 2023. Prior to that, I was in the Associate Director and Manager of the Raising Our Children program roles. I was previously with the Ontario Native Women's Association's Aboriginal Healthy Babies, Healthy Children program in Sioux for more than 15 years and worked for the Northern Anishinaabe Education Council for several years before that. I'm a proud member of the Wiindamekewinan, a mother of 3, a sister to many, a wife, a daughter, and a granddaughter. I'm dedicated to promoting health and well-being in First Nations communities because I believe that everyone deserves to live in balance, physically, emotionally, mentally, and spiritually. ACW is committed to supporting approaches that honor culture, language, and connection to the land as foundations for wellness, not just the absence of illness.
Bonjour, Neen Candy Edwards, Wiindamekewinan. Nigipe ogamau kawi inakeshkagatek apawaning minyawan ohma SLFNHA miwe September 2023. Wedo odanang Associate Director Mina Manager ngi pinanuki enitawa kihangato nanichana shinanak wichiwewan. Kiabita Wasade, Ontario Native Women's Association Ningi Anukawa, Aboriginal Healthy Babies, Healthy Children, Wananawangang Awashme Nyana Nushabyake, Mina Ningi Anukawa, NNEC Numake. Niminwentan ka onchian anambigo sagaigan anshnabek. Nisawag ni Janishak, Mishini Jakwek, Niwi Wamau, or Dan Smau, Nose Smau. Nimbagatin des Jawid Stoyan, Minyawan, and Shinanikang, Etebwetaman Gakana Awia, Jimino Pimatasich, Omia Wank, Omos Hornink, Omamet Ninjaganink, Mina. O dachakong. Gawi inakeshkagatek apawaning minuyawan o we chan ga ktenda minute and shinaniwa tesuinene. Ishiki shwewinene mina apatstot pigwatakine ewi winche minuyach. Gawaneta ega chinakwak ahkusuwan.
Good day, everyone. My name is Dr. Lloyd Douglas, and I'm the public health physician here at the Sioux Lookout First Nations Health Authority. I want to talk to you about routine vaccinations. Our communities are strongest when we take care of each other, and that includes staying up to date with routine vaccination. Lately, diseases like measles are making a comeback in Ontario and in Manitoba and all across Canada. These illnesses spread fast, and without vaccines, they can cause serious complications, even death. But measles isn't the only concern. Other vaccine-preventable illnesses like whooping cough, mumps, or even certain types of meningitis can also threaten our health, especially for children, elders, and those with weaker immune systems. Routine immunizations help our bodies build protection before we're exposed. Vaccines are safe, tested, and free. Most are given during childhood, starting at 2 months, then continuing into school age. They are also important boosters for teens and adults. And if you missed any, it's never too late to catch up. Whether you're planning a trip, heading back to school, or just want peace of mind, now is the time to check your immunization records. Let's protect what matters most: children, elders, and your way of life. Talk to your healthcare provider or nursing station about routine immunizations. If you have questions, you can also email us at acwinfo@slfna.com. Protect our past, safeguard our future. Keep up with your routine vaccinations. This message is brought to you by the Sioux Lookout First Nations Health Authority.
That's great. Thank you so much for sharing. Can you please tell us about the Approaches to Community Wellbeing Department and its role within SLFNHA and the communities they serve? Wiindamekewinan Approaches to Community Wellbeing. Egotske anin meamenan kuads, egotske anin ezwichihads, ishkunganan gayagan nahing Kiiwetinoong.
Approaches to Community Wellbeing, or ACW, is taking a holistic, community-driven approach to health, one that focuses not just on individual care, but on the well-being of the whole community. ACW's objective is the Anishinaabe people of this land are on a journey to good health by living healthy lifestyles rooted in our cultural knowledge. Its guiding principles include language, history, family, connection to the land, and honoring choices.
Kawi inakeskagadek apuwaneng minyawan, kasi mesuwayak yanik Owisi ano katan. Eka kasi pesukut chuwich hinch, kakina awiyak chuwich hinto. Kawi nakeskagadek apuwaneng minyawan, kakagwe ischigech. An sinanawag meno ayawaneng anishawag, meno pimatasuan ewi utah penamuach, o kikino hamako wenwang ka atenek. Mika wanche mi kosheng otesikiswewen. Otana pichigewen, te pinchigewen, akihkan ka onche sagesheng, Mina ektenchikatek onenta moen.
ACW's goals are more integrated, sustainable, proactive supports, increased community ownership of health, more children growing up healthy, safer communities, and more people making healthy choices. ACW offers programs and services such as community well-being nursing, youth development, health promotion, infection prevention, harm reduction, and more, each tailored to the needs of the First Nations communities we serve.
Gawi inakeskagadek apuwaneng meniyawan. Wiitanno kiiwetinoong. Eka che iskwasek, che aswahaman, che matsek, che kanawenimituach, Menuyawaning Anshinwak. Kiabit Abenoti Sug Chiminuyawat. Chipetagak Apuin. Machine Awiyak Menuyawaning Tisha Odapinagewat. Kawi Inakesh Kagadig Apuin Menuyawan. Wichiwewanan Dabiskoj Maskikwe Odanukiwan. Oskadas Owichigowan. Menu Ayawan Kanochikewan. Ega Chiaso Hiwet. Ega Chibichitota Such Maskikikech. Kakina Jesus Chigatinik Apewanak Kashi Antawentamuat.
Could you tell us how approaches to community well-being is helping build wellness in our communities? Ego gadawin demoshnamna iwe gegunin anin meaminan huaj approaches to community well-being ajgadig ahing anin ezwichio aj ishunganan Kiiwetinoong gayat.
What we are doing is shifting the focus from fixing illness to supporting whole community wellness. That means strengthening cultural supports, building local capacity, supporting families and youth, and working in partnership with community leadership. The model is flexible, so each community can adapt it to their own traditions, land, language, and priorities.
Miendo tamang egai ewi mustu wawich tuang ahkusuin. Dekwach kakana awia chiwi chihinch chimenuyach. Je maska wasingen ansiniwe wichiwewanan. Jiane maskawak kashkahoen. Je wichihinda tibenchgewanak mina oskatisak. Mina Wiindamekewinan oniganistamagik. Wichiwewan pekwante tagistotsigate. Apewanak utaki onentanawa wa inapatstoach opemeuchigewanoa. Akine isigiswewan mina niganachgewanan.
What does that look like in communities? Some
of the work we are doing includes providing seasonal and routine immunizations with a focus on measles, educating and offering testing programs for sexually transmitted and blood-borne infections, including dried blood spot testing, finalizing an evaluation of the needle distribution service, offering mental health first aid First Nation trainings in community and with partner organizations, supporting community emergency response planning, coordinating incident management system training, developing a community evacuation guideline document to support communities, providing education, presentations, and resources on practices that reduce the harms of substance use, completing a maternal newborn health status report expected to be completed next year, hosting 2 LGBTQ plus youth camps, working with tribal councils to support students attending high school here in Sioux Lookout, conducting well child health assessments, offering cancer screening, providing case and contact management for tuberculosis and COVID-19, offering health promotion for back-to-school immunizations and the upcoming respiratory season, including reminders for influenza and COVID-19, offering Northern Food Incentive Program funding for schools this fall for supplies, incentives, and resources, and other purchases to support delivery of the Northern Food Program, and completing a food costing report expected to be completed by the end of October.
Anda anukiunan kadutamang. Kani tagwakin akigokak. Njistahuemin mawach. Nindasawa pandamen miskusewan. Ningkinohamakemin kesi kutjasquenach. Wiindamekewinan danantunang mina meskuihkan ka asuhiwanawang kaye pahte mesko kuchtikewin. Chikise chikatek enanokimakanekwen chistahikewa pehkon umaskikik kamindo. Mental health first aid. Nistam shemag gawich hint awya nanda umambitnitsganen gages cheese sage kekenohamagewin. Waways hinda awiyak mina ankinaganak chikoyak pime kanawen tamuach kichis sewenan kekenohamagewin. Che unachikatek ke pimen sahigatek apen machi ahkasawaj anshinenwak. Nen kekenohamagemin nen tipachemomen mina Abadstaganan kewich hikoch awia ekache babchitodasut maskikikech. Nanantawen chikewen eshiyanekwen kakikishkawasuch tanekichikate minawa akiwak. Katakun hinto ka pahpakana tasuat uskatasak. Ewitan kiminto tribal councils to which hawat utos utiskonin wananawangang. Misawe che nana kachihins awasis tepwe chiminiyagwen. Chikakwe chihins piwa peko manichoshan kikskawagwen. Chipime kanawen chikatek TB mina COVID-19 akwasuanan enishishkamakanekwen. Skoniwe chista howewenan mina Takwakanowe akikwapinewen chiki mamatune chikate kaye COVID-19. Kiiwetinoong michim asange wichiwewen o teskoni ko wichiko winwa netonche tepahamen. Nintane kisha kindamen an enakintek michem ane kisha gesut October ninkakis tomen.
Thanks again for that insight. Approaches to Community Wellbeing is doing a lot of work. One of the strategic directions of SLFNHA is focus on determining community-based healthcare needs and aspirations and developing long-term community relationships. How does ACW help deliver on that? Miwa miigwachkidnuguna iwanungagi Wiindameg. Egochke mawajuga unachungenanung anin meamgawinan huinanung egi pagdngadeg kegunenan iwanun ishkunganun keunje wichigwaj egochke anin ez boxensgadeg iwe angedujgadeg ankuingab mujgadeg dawin demosnamna anin mayam iwegawistudameg ankuingab muduyek.
ACW aligns with that direction by engaging communities in planning, looking at what matters to them, what their health goals are, what their strengths are, and then working together to build programs that reflect those. We build relationships, invest in training and capacity building in community staff, honor First Nations knowledge, and ensure the health system is rooted in communities and not just delivered to them.
Kawi Wiindamekewinan apiwinan minuyawan uwijihan apiwinan ene unachigech kanawa pandamuach kikunenene ka kichinen tamewach ane shikakwe minuyawach maskawa tsuwach kwa kaye Wiindamekewinan Wiichiweunan chustuach. Nentostomen Wiindamekewinan. Anokiwen nenkehkenohamakemen mina. Che okashkehonawach. Anokinaganak. Kehtenchikatek anishniwek kentamawan. Mina kehtsenach. Kusiwe Wiichiweun. Chiabadak anshenikang ega chumushimindo.
At Sioux Lookout First Nations Health Authority, we're committed to building strong, supportive teams, and we focus on hiring First Nation employees wherever possible. Whether you're just starting out or looking for a career change, SLFNHA offers competitive wages, comprehensive health benefits, a pension plan, and even fitness reimbursement. Visit www.slfna.com/careers to explore current opportunities. SLFNHA, health careers grow here.
Wow, I am impressed. Can you share an example? Miwe majugumuntagun iwenun ankriunan gab mujgadein gdawin de mosnam kegunen basic iwe gajgade iwe ankriun gab mujgade.
Absolutely. For example, we have youth worker networks and cultural activity workshops that bring elders and youth together. We also support infection prevention programs that reference local food gathering traditions and build safe community initiatives that are designed to reflect each community's unique context. These aren't one-size-fits-all, and that aligns with SLFNHA's strategic commitment to community-led, culturally grounded services.
Wiindamekewinan uskatasag Mina anshiniwatisuan kiknohamaganawan kishihag Wiindamekewinan uskatasan. Kaye newijistomen asuhiwewen ihabatstoyang mamusuwen. Kaye kewenche pehtag sewat awiyak Tapuinawang. Gawin pesik ke konen kakena awia uki minuskagusin. Mitas hiwe esi kanawa pantang SLFNHA an sinanawan kauto kemamet.
That's really important. Thank you both for sharing about approaches to community well-being. Is there any upcoming news and plans you want to share with our listeners? Majugu kchimigwachkidnguna ginwagaj nijig ima Wiindamekewinan Wiindamekewinan keguneniwa approaches to community well-being gajgadik. Egochke kegunen kegi Wiindamekewinan gabien kwadameg keguneniwanun.
Miigwech Charles. ACW is offering an infant feeding training event for community workers, also supporting community events during National Addictions Awareness Week, planning a food sovereignty gathering, and developing a food sovereignty advisory group, also planning a Northern Garden Mentorship and Training Exchange Program and Gardening the North in Community Training and Consultation Project, also hosting a men's empowerment violence prevention event.
Thank you, Charles. Kawi inakeshkagatek kapunang minyawan kaichikatek. Kikanohama wento mama utanukik. Keishino na waswach. Che wich hindo anshininwak. Chuwenche Kiiwetinoong but Wiindamekewinan Miigwech National Addictions Awareness Week is a sick. Chuwenach Chigatik Mamo Wiindamekewinan Mawachituin. Che Unasindor Mamo Wiindamekewinan Ukanochiketamagik. Kitegewe Kinohamagewen che Unachigatik Mina Chitasindamawandor and Shinanwak. Che Unachigatik Nabe Mawachituin. Che Kinohamawinch ke Ontinang Masko Wasiwen Mina Chiponi Mikasuch.
For information about these or any other ACW services or programs, you can email acwinfo@slfna.com, follow SLFNHA and Anishinaabe Youth Network Facebook pages, or call 807-737-5189.
Kiabe Wiindamekewinan Wiindamekewinan Bimasna again acwinfo@slfna.com. Biminazaho SLFNHA Mina and Anishinaabe Youth Network Facebook. Bakiganaganan. Nanda Pikatun 807-737-5189.
So that concludes today's show. Thank you for tuning in to SLFNHA Radio Connect, where we are building strong connections with communities by sharing who we are, how we can help, and the services we offer. Connect with SLFNHA on our Facebook page or on our website at www.slfna.com. Miapnugiwe etibseg noum imaga Wiindamekewinan akwazio ankyun gabmujgadig ima SLFNHA Radio Connect. Mawajugu aikadnanun ishunganan chuitan kwimanda anshinwagega anshinabeg egochke anin gegizwichigu emban iwa akwazio ankyun gabmujgadig nigat.
Recorded and produced at Wawatay Communications Society.